In this video, we'll go over the straight leg raise test to look at hamstring length. Your patient will start in supine with their knees extended. Stabilize the distal anterior femur and the posterior distal tibia to maintain knee extension. The test motion will be passive hip flexion. Be careful to maintain the pelvis in neutral. The test is considered negative and the hamstring length within normal limits if the patient's able to reach 68 to 80 degrees of hip flexion while keeping their knee extended. The test is considered positive if the patient cannot reach 68 degrees of hip flexion with their knee extended. In this case, we'll try bending the knee to put some slack in the hamstrings. If flexing the knee allows an increase in hip flexion, the limitation was likely due to tight hamstrings. If flexing the knee does not produce an increase in hip flexion, the limitation is likely due to a tight gluteus maximus or structures within the hip joint. Stop the testing motion when further hip flexion would produce knee flexion, posterior pelvic tilt, or lumbar flexion due to tension in the back of the thigh. To document a patient's progress, measure the amount of hip flexion when you reach the end feel.